we round to really get the buy-in from our staff and really get a pulse of the building as to what's going on in the different departments and the different teams and what they're dealing with. We like to explain the whys as to why we're making decisions that we're making in our roles and our positions. I think that's been the most beneficial reason as to why we round here.
I would say two things. Obviously, visibility. I think it's really important if you're in our roles to be as visible as we can throughout the building and actually the region. And along with visibility, I think we need to listen. I think the key thing, if you're in roles like ours, is to be servant leaders. And our job is to create a climate so that people can do their best here for our patients and their families. You cannot do that if we're not listening to the frontline staff and then hopefully responding to their concerns and fixing problems that we pick up during the rounding process.
So why do we round? Rounding is all about providing support to staff and providing senior leadership with a perspective that they wouldn't otherwise get without coming to see staff and rounding on the units.
Gives me a chance as a leader to explain my strategy for the West region, which is always changing, and it also gives me a good chance to identify the people behind the scenes that are allowing this type of strategy to take place and allow me to make plans for future strategy.
I believe the most valuable aspect of rounding is building those one-on-one relationships with the people that you don't see day to day, the people that you don't work with day to day. And like in the emergency department, we see the nurses, we see the manager of the RN, our manager, our coworkers all the time, but we don't necessarily see the senior leaders. So having that rounding allows us to build that one-on-one relationship, know them by their first name, and be able to see them if we're throughout the hospital or anywhere out in the public.
One of the most valuable aspects of rounding is listening. In talking to the individuals, you have a chance to hear what their concerns are, both positive and negative, and it allows me the chance to be able to go back to senior management and state, here are some areas that we can improve in.
You have that one-on-one time, more personal time to really listen to what they have to say, and then it gives us an opportunity to maybe communicate some things, and I think thirdly, it gives you an opportunity to thank the folks.
I think the single most impactful part of the rounding was what happened after rounding. The concerns that staff had brought forward, the senior leader followed up on those, and he followed up a couple times with me, and then he followed up with staff, really made sure that the concerns that were raised were actually followed through on and taken care of. He provided a barrier buster for me, something we had been kind of working on for a while, but just hadn't quite been able to move the mark. So he did a really good job in getting that done.
One of the concerns of rounding, I think everybody would have, is time management. We all have hundreds of emails coming in, meetings, etc. But I would say that concern is totally invalid, because the time you spend rounding and meeting the individuals in the various departments gives you that quality time where you can not only hear their concerns, but they can hear what's going on in your operation. So even though it does take time, it's well worth the investment.
Well, I think we had some concerns initially with how are we going to find the time to do this, with our busy and hectic schedules, how are we going to squeeze this in? Another worry that we had was how are we going to get this coordinated? We really needed to tap into some of our resources in order to coordinate that. And ultimately, how were the staff and the managers and the other leaders that were involved in this process, how were they going to find the time and allot that time as well too to help support what we were attempting to do for the teams?
My biggest concern about rounding initially had to do with the time constraints and was it going to take a chunk out of my day that could be better used elsewhere. After the first and the second episode of rounding, I saw that it was oftentimes the best part of the day.
I think one interesting aspect of this is my whole career I've tried to be very visible. I try to walk the entire building here almost every single day. But this is a little different. This is much more detailed, much more focused, much more structured. I think for me, I think it's an important lesson for everyone. If you're in a leadership position, sometimes you have to get outside of your own comfort zone. And I'm a pretty glib person. I'm not an introvert, but this was a little nerve-wracking when we first started to do it in a much more formal way. But I've been doing this a long time, but it's been a great learning experience for me because it took me outside of my personal comfort zone. And I think it's made me a better manager and a better listener.
It really began a trusting relationship with the staff. Whereas they had concerns early on that they weren't sure why, what was the ulterior motive perhaps, but they absolutely trusted that the reason why the senior leader had rounded was so that he could make a difference, and that did begin a trusting relationship.
You know, looking back on some of my concerns on time management, it's not even an issue anymore because now I actually look forward to rounding with the various departments. Most recently went to pharmacy and just seeing how all those charges flow through and everything like that was very valuable. So my concerns were alleviated after I began the process.
If rounding doesn't take place, I believe that there's a huge amount of opportunity lost, and that being that the people providing the work in the lower levels don't get a chance to meet their senior leader and identify what he or she's all about. And the opposite case would be that we as senior leaders don't really understand what's going on down beneath us to make sure that things are run correctly and with patient first in mind.
We're here as a healthcare organization because of the patients. It's about the care that we deliver, and it's about caring, and senior leaders don't necessarily get to see what that's like from behind a desk.
I think the opportunities that are missed when rounding doesn't take place is having that security of trusting somebody in a senior leadership role that obviously plays a big part in the decisions made for the hospital. Every day we have that same relationship with our patients. At the beginning when I walk in, unless I've visited them before in a 911 call, that first 30 seconds is vital to earning their trust and showing them that I can take care of them. And I believe the senior leadership has the same thing of responding out to the different sections of the hospital, getting to know people, and trusting them that they're going to make the right decisions for my future career and for the future of our patients.
It really helps with our credibility, being visible, and just being open ears and really proving that we're here to help break down barriers and support the teams in the great work that they're doing.
It just is another opportunity to thank employees for what they do.
It takes every single individual to make the hospital run. And I think as senior leaders, it's our responsibility to make sure we understand how the whole organization works and help it to work as efficiently as it can.